Every day, all over the planet, millions of people, animals and products come and go. Potentially traveling with them are several known and unknown health threats, such as infectious diseases that can cross over borders and continents and endanger public health. Improving safety, security and protection for all citizens against health threats are concerns at the very heart of the European Union's health policy. Recent outbreaks such as the Ebola epidemic or the new emerging Middle East respiratory syndrome are testing the European Union's capacity to respond quickly and efficiently to these cross-border health threats. In 2013, the European Parliament and the 28 member states agreed on a legal framework on serious cross-border threats to health called Decision 1082 that provides mechanisms and tools to manage health crises in the EU. Whilst individual member states are responsible for their own health measures, Decision 1082 supports cooperation and coordination between member states in order to fight against cross-border health threats such as threats of communicable diseases that can easily spread from person to person and country to country, and the threat that certain bacteria are becoming resistant to drugs and medicines. Threats of biotoxins from plants such as ricin that could be used intentionally to harm people. Threats of chemical origin that come from acute releases of toxic chemical products. Or threats caused by environmental events, such as a volcano's ash clouds, or extreme weather events linked to climate change. Decision 1082 encourages all member states to better prepare for future outbreaks by sharing their information, sharing their best practices, and ensuring that all their preparedness plans are compatible, consistent, and effective. Decision 1082 also allows member states to be part of a new venture in joint procurement to obtain medical countermeasures such as vaccines and medicines. Furthermore, Decision 1082 has established epidemiological surveillance to constantly monitor over 40 communicable diseases across Europe, and ad hoc monitoring when health threats caused by chemical, environmental hazards or biotoxins occur. Member states use the Early Warning and Response System, EWRS, to immediately issue alert notifications to the Commission, to member states, and to the World Health Organization, WHO, about the nature and the location of the threat concerned. In case of an outbreak, it is always vital to know what danger exactly does the threat pose, and what are the risks for the people in the European Union. European agencies and scientific committees will carry out risk assessments of threats to suggest options and appropriate measures that can be taken by crisis managers. During a crisis, the Health Security Committee, HSC, composed of representatives from all of the 28 member states, will consult each other to coordinate measures to an outbreak based on the risks involved. The Health Security Committee also consults on crisis communication to agree upon messages that can be used by public health authorities to ensure that both the general public and healthcare professionals are provided with clear, consistent, coherent information. Eventually, if required, international organizations such as the World Health Organization will become involved, and international partners from other countries will be consulted whenever necessary. Supported by the Commission, Decision 1082 gives us the mechanisms and tools to manage public health crises that help us to improve health security in the European Union. Solid crisis preparedness ultimately protects Europeans against health threats and prevents additional burdens on European health systems. We cannot anticipate every disease and every threat, but together we can be prepared for the worst and be ready to act quickly should we have to deal with a crisis. Decision 1082 – Crisis Management for Serious Cross-Border Health Threats in the European Union.